Hypnosis may evoke memories of the Twilight Zone, but these days the practice is being used for everything from weight loss to overcoming phobias. The question is, would you forego anesthesia for hypnosis in the operating room?
Would you consider going through surgery without anesthesia? One hospital is conducting a clinical trial where patients forego anesthesia for hypnosis. MD Anderson Cancer Center in Houston is exploring hypnosis as an alternative in the OR. This is not the type of hypnotherapy that leaves one clucking like a chicken, but instead, receptive patients are guided into a deep state of relaxation. One of the risks of having surgery is not the surgery itself, but the general anesthesia. So could hypnosedation be the answer to safer healthcare?
And joining us via Skype is Dr. Lorenzo Cohen, the Director of Integrative Medicine at MD Anderson Cancer Center, and hypnotherapist Rosalinda Engel. Thank you both so much for being here. Fascinating topic. And we were having quite the discussion regarding this before we came out on the stage. So Dr. Cohen, I want to start with you. This whole idea of doing surgeries with hypnosis instead of anesthesia, tell us about how that even started.
Well, surprisingly, it actually came from our anesthesiology and surgeon colleagues. There's many procedures, including this one of early stage breast cancer surgery, where we give general anesthesia, but the anesthesiologists who've had some experience with clinical hypnosis, procedural hypnosis, were under the belief that they didn't actually need to be giving the general anesthesia. And shocking to me was that anesthesiologists have said wherever they can avoid giving general anesthesia, that is their preference because of some of the harms of general anesthesia, weakening our body, decreasing our immune function, and slowing recovery. And of course, this is all contraindicated if you're doing surgery for cancer. We want our immune system as strong as possible. So this has been thrilling to have this actually come from the surgical suite to us.
So Dr. Cohen, how do you actually present this option to patients?
The initial discussion is actually presented by the anesthesiologist or the surgeon in terms of floating the idea by them, saying that based on your procedure, you are eligible to be able to have hypnosis during surgery, and this will allow you to avoid being fully unconscious and getting general anesthesia. And essentially saying, would you like to learn more about this? And then Rosalinda is the one who would then provide more detail for the patients.
Rosalinda, I want to ask you, because I'm, as a matter of practicality, trying to imagine now you're in the OR, you're there with the patient. Obviously, you have the anesthesiologist, you have the surgeon as well. So practically speaking, obviously, you want that patient to truly become hypnotized. How does that work? Because you're there throughout the surgery.
Well, we actually meet the patient a couple of days before surgery, which for some people, even that is a very short amount of time. But it's interesting. We'll find out if a patient is suggestible or not. And some people are more and others are less suggestible. It's not a weakness. It's actually a strength to be suggestible. But we will determine that through a number of assessments that we have. And then one-on-one, I'll meet with the patient, offer them a 20-minute session where we'll go a little further into what they'll experience the day of surgery. And that also gives us invaluable data as to how the patient will respond the day of. There's no way to 100% predict, but we're getting closer at understanding the communication style of the patient and whether or not they can put what's happening in the room aside, shift their attention, and go to a very wonderful deep place of calm and ease. And for those people who feel like, well, that's a special talent that not everyone would have, you might be surprised to know that 2/3 of the population is highly suggestible. And advertisers know this and make good use of that.